Ohio Governor John Kasich will soon decide whether or not to sign his state's so-called heartbeat abortion bill into law. The measure was approved yesterday, would outlaw abortion once a fetal heartbeat can be detected. That can be as early as 6 weeks into a pregnancy. Now, under that guideline, the law would also ban abortions even in the case of rape or incest.
Is a surgical procedure usually used up to 16 weeks after conception and is typically performed under local or general anesthesia. The cervix is numbed and opened wide enough to pass a slender tube into the uterus where suction is used to empty the contents. Within the same timeline, a DNC or dilation and curettage abortion can be used. First, the cervix is dilated using small instruments or medication, and then a curette is used to remove the contents of the uterus. If a pregnancy is between 12 to 24 weeks, a D&E or dilation and evacuation abortion is likely used, although only 1.2% of abortions occur after 21 weeks. In a D&E abortion, the cervix needs to be dilated wider, often using osmotic dilators, which are short rods made of seaweed or synthetic material which absorb moisture and slowly stretch the cervix. These are usually inserted the day before surgery. Once dilated, fetal and placental tissue is removed via vacuum aspiration, forceps, and a curette.
This bill should be put into place is because this procedure that you just saw in the previous video is not the most comfortable or nice to a woman's body. There are also a lot of emotional problems that could happen before or after the procedure. For example, after the procedure, a woman could feel regret for making the decision that she did. The main reason this bill should not be put into action is because it takes away the 14th Amendment right that basically says no state is allowed to take away life, liberty, or property without due process or deny equal rights or protection of the law. This amendment was put into place because of the court case Roe v. Wade.
A woman's access to an abortion or make abortions illegal do not reduce the number of abortions. Countries where abortions are illegal have roughly the same number of abortions. What changes instead is the incidence of unsafe abortions. A 2011 study did find that state-level anti-abortion laws in Texas correlated with lower abortion rates in the state, but these results did not account for women traveling to other states with less restrictive laws to receive a procedure.
Inside this bill, it also states that there will be some birth control methods such as the pill, hormonal ring, IUD, injection, and implant that will no longer be covered by insurance or completely banned in the state. Now that you know a little bit more about both sides of the heartbeat bill, which side are you going to choose?